uh, we everybody knows what the problem is, everybody is aware of what everyone is doing, so that
participated in health, social welfare and development, local governance, and drug laws and policy. So we will go presentation one by one with our rapporteur. No, we are running a little late in our schedule, so I'll announce some adjustments. For our coffee break, we will make it a working coffee break. So while we're having the presentation, please get your coffee and snacks. I hope our presenters won't mind that we'll have a working coffee break. And then afterwards, we'll proceed with the CSO panel. And finally, we'll present with a final presentation from Pat and Jeannie, which we will convert a little to more of a dialogue question and answer with some of their insights as well. But we'll manage the time depending on how much time we have at the end. Okay, sounds good? Okay. So the first group to present is the health group. So the rapporteur from the health group is our Department of Health, Mr. Jude Daval Santos. And then after the health group, it will be followed by the social welfare group, and then followed by the local government, and finally the drug laws and policy. By the way, after the closing ceremonies later on, we'll give some announcements, especially for participants who will be checking in and doing the rest of the week. No, so please stay put later as we give you more logistical announcements.
Hello, I call for your attention. So mula sa Group 1, hello, good afternoon. Uh, I'll be discussing for the health sector. This is composed of the Department of Health from the substance use and alcohol portfolios, from the Quezon City Health Department, the City Health Office of Antipolo, UNODC from the U.S. Centers for Disease Control and Prevention, from our partners in the UNA, UNAIDS, Mandaue, LGU, IDO Care from Cebu City Health Office, and Cagayan de Oro Health Office. So this is our group picture. If you can identify any one of us, so ayan po. So for the first question, what are the needs and gaps from the health sector to approach substance use from a public health perspective? So there are a lot of things that the group mentioned, but basically it revolves around the continuum of care from health promotion to treatment reintegration and aftercare. One noteworthy comment with regard to health promotion was health literacy. Some people who use drugs have no idea or are still confused if whether this is a health condition or is it something else. Then for other areas for consideration of the group as something that will need bridging would be the health system components. So from governance, financing, leadership, the human resources, and info system. With regard to governance, they mentioned that there has to be a shift in in the headspace or in the framing of substance use among local chief executives. With regard to info system, there should be an efficient information management system and exchange of data among users. Next. For the short-term action points, this would entail and would mostly cover those components under the health system. So one is the integrated facility or primary care for several disease conditions such as HIV, mental health, and substance use. Then they mentioned that focus group discussion among agencies, national government and local government agencies to cover substance use with regard to law enforcement and media. As mentioned earlier, with regard to info management system, they require a synchronized data gathering and information exchange among stakeholders and revisit the work and mandate of anti-drug abuse councils at the local level. They also mentioned as a possible short-term action point from the health sector to approaching substance use from a public health approach. For long-term approach in addressing the identified sector gaps or needs would be first to amend RA 9165 approach to substance use. There should be parallel efforts from the education system on pragmatism and human rights. With regard to primary care or universal health care, we have to institute and strengthen our primary care to address several disease conditions from substance use, mental health, and other comorbidities. And for DDB regulations, as mentioned, from short term to long term, we can amend existing DDB regulations to mainstream public health approach to substance use. And there is a special discussion on financing our response to substance use, especially with regard to ensuring our public health approach to substance use. So for the identified stakeholders, from the national, foremost, we have the national government agencies led by the DDB as the highest drug policy body in the country, with DepEd, the interior and local government, especially from the public health sector and the national health insurance system, and from the criminal justice system from DOJ, BJMP, and Bucor. With regard to the local government system, we have the local drug councils with strengthened role for the health and social welfare sectors. Then, especially other stakeholders that are usually overlooked would be our people who use drugs, the most affected uh, people and our people of concern, and especially the existing medical specialists and the academe. So that's all for the health sector. Thank you.
Thank you very much, Jude, and the health sector. Again, a warm round of applause for the health team. Let's now call on the next group, the rapporteur from the Social Welfare and Development Group.
All right, good afternoon, everyone. My name is Paolo Martin Severon, and I am the Executive Director and the Designated Local Youth Development Officer of the Cebu City Government. So I am here to speak in behalf of my colleagues in the social welfare and development, along with my fellow colleagues who are also working in the youth development in development works. So before anything else, we would like to say thank you to our facilitator, si Attorney Kathy Alvarez from Street Law PH. Same goes with our note taker, Dr. Van Philip Baton of UNAIDS. All right, so for the first part of our workshop, our output is. I, okay. So we share the same guide questions, and the guide questions, we have a total of 4 guide questions. And then for the first guide question, under our sector, what are the key needs of people who use drugs and gaps in programs and services that may be addressed by a public health approach to drugs? Please provide 5 to 10 points. So number 1 is access to information, specifically to criminal to a health issue. Next is we have drug policy. Third, we have the lack of awareness of the services that are available for them. Number 4, having a drug list prevents them from accessing government services. There is still that there is fear, stigma, and discrimination. And number 5, treatment to PWD from service providers, health and non-health. Number 6, youth and adults PWD are not engaged in the planning of services on drug use and need to consult PWD, especially in every aspect of, especially in, in developing programs or in the development of policies. And then number 7, limited persons who are confident or not capacitated in handling drug use in the youth in particular. And then number 8, lack of interest from PWD to participate in the program. Number 9, no financial socioeconomic support for the youth, leading to be engaged in the drug trade as a means to support the system for PWD and their families for health and non-health needs. And then for the second guide question, these are the short terms that we have identified. First, we have harmonizing the activities and policies of different programs, groups, sectors, and collaborate in all steps from planning to implementation. Second, creation of a multidisciplinary team to harmonize and integrate services and the program. And then number 3, to engage the Katipunan ng Kabataan as the venue to discuss and engage the youth in issues related to drug use, including the PWD youth, strengthen the implementation of the SK reform law in the local government unit level down to the barangay level. Number 4, orientation for different levels on referral system for PWD and their families. 5, training needs assessment and capacity building activities for policymakers and providers. And lastly, we have expansion of the SK mandatory training to include advocacy issues, especially now that the election is coming. And I think that is also one of the opportunities that we have in the implementation of the SK reform law. The training modules are not really good enough to make our young SK officials be more prepared and be more efficient with the responsibilities, no? And other than that, it's more that mas mataas yung expectations sa kanila, mas maliit yung input, but the output that we expect from them is sobrang taas o sobrang laki. So third guide question is ano yung mga long term. Number 1, policy reform, specifically for RA 9165, RA 9344, and other relevant laws and policies. And then number 2, elimination of the drug list system. And then number 3, change the standards of declaring drug-free barangay. Make it more yung public health, yung approach, more developmental. So number 4, implement harm reduction. And number 5, institutionalization of the barangay level and all LGUs program services for PWD, health, and non-health. And then for the last guide questions, who are the possible stakeholders who should be involved and engaged in the process? Of course, number 1 in the list, we have the PWD, then we have the young people, service providers, barangay officials, barangay health workers, the ADAC, social workers, law enforcers, the family of PWD, various social institutions, including the church, the academe, the media, and whatnot, the government. Thank you.
Thank you very much, Social Welfare and Development. I think hindi natin nakita yung photo nila, so balikan natin. Very important. Okay, so once again, round of applause to the Social Welfare and Development. Let's call on the next group, local governance. May I ask for the rapporteur?
How many minutes am I given? Just 5. I thought I'm given an hour. All right. So before I start, may I ask everyone and tell her or him, you look beautiful today. All right. Isn't it nice to be affirmed? Right? So once again, good afternoon, beautiful people. Maganda po ako sa inyong lahat. Magandang hapon po sa ating lahat. My name is Christine. I'm representing the LGU sector, I mean the group. They actually voluntold me. I did not volunteer. So pardon if I have the Rod Stewart voice today. All right. So under the local governance team, we have the Quezon City LGU, the Pasig LGU, Marikina LGU, DILG, OHCHR, Antipolo LGU, of course my LGU Cebu City, Cagayan de Oro LGU, and JJCICSI. Right, that was a tongue twister. All right, so can we give a round of applause first for the members of the team? Is it right or left or right? Okay, sorry. See how beautiful we are? I think we are the most beautiful group because of our pose, all right? So we were given 4 guide questions, right? So let's start with that, starting off with the needs and gaps agenda. But again, let me just share, just really quick. It was a sight to behold during the meeting because everyone had a lot of ideas and information that they imparted, probably because they are from the LGUs and they are the ones who are doing the groundwork. So if we were supposed to be given a day, we would have given you a book with all the ideas, all right? So needs and gaps agenda. First is the consistent development of program for PWOODs. It means that not all LGUs adopt the programs, especially those who are in the far-flung barangays and municipalities. And there's also a need for dialogue and adoption of best practices. So if best practices can only be shared by those who are in the first, like the highly urbanized cities with the third level municipalities and all, if there will just be a dialogue for that. And then there should be a deeper understanding of what drug addiction is. And as a disease and the multi-factors that leading to it. Because we all know that the understanding of most of the communities is just that it's addiction. It's just substance use, abuse, and misuse. But they don't really know that it is a mental disease. And just like any other diseases, it needs to be treated, right? So once they get a deeper understanding of that, perhaps it would be possible for all the programs and more ideas to be shared into helping out the PWOODs. Next is the discrimination, the denial of services, especially economic and financial, to our PWOODs. This came out because one incident happened in Cebu City that a person or a personality who's in the drug watch list already enrolled in the CBDRP program. Unfortunately, when the employer learned that he was in the drug watch list, he was terminated. So there is really a need for our PWOODs to have a sort of a security blanket when it comes to their financial and economical needs. We also determine the punitive drug policies in companies. That's piggybacking on the economic and financial discrimination. There's also lack of economic support to PWOODs and drug reformists. The need to educate private sector, especially the employers like banks, on the rights-based treatment of PWOODs and importance of policies on illegal drugs. Because instead of suspension, they are already, struggling with their mental disease or with addiction. And you're also, if terminated or if you're not given the opportunity, then it will add to another problem. So instead of just being a user, if he doesn't have any economic means, he could be a pusher, right? He could level up. So that's also one of the needs and gaps that we've determined. And also the distinction of interventions for users and pushers, because there are different intervention programs for users and another one for pushers. Next, the need for job placement data on employees who are former PWOODs. Like we've determined that there is a need for us to check and make a database on those PWOODs who were given the chance to work, like if they are hired as JOs. And with this, Quezon City is good with hiring from the sector. May we give them a round of applause. Quezon City, good job. I hope that will be um, replicated in other LGUs. We also determined the peer-to-peer partnership programs between LGUs and businesses for hiring. If only we'll have a collaboration to, of course, make sure that we also give equal opportunities to our PWOODs. Sustainability, turnover of administrations, officials, non-pursuance of adoption of existing programs and policies. That is because every 3 years, we change leaders, we change administration. So it has been an ongoing problem in the barangay level, even in the municipality and city level, that every time there is a change in administration, there will also be a change of trained personnel. There will also be a change of program designs and all. So that is a recurring problem every 3 years. Next, the need for training of non-medical personnel in LGUs. Good practice is the DOH certification for non-medical staff in Cebu LGU. So most of the time when DOH does their training, they always invite participants who are in the medical field or are clinicians, who are professionals. But since the hashtag a while ago, it became a hashtag of mine that um, do not if not for us it's not for us if not with us, right? So um in Cebu City we hired P Woods that are recovering P Woods for our as facilitators for our community-based drug rehabilitation program, and luckily they are all trained by Department of Health. Next, the need for the CBDRP plan accredited by DOH. The good practice is for Antipolo. We have Antipolo LGU working out the citywide guidelines for 16 barangays for service referral. So unlike Central Visayas, we actually have a DOH module that we are following for the community-based rehab program. But other municipalities and other regions, they don't have that. So as part of the needs and gaps that we've determined, there is a need for the CBDRP plan to be accredited by the DOH. And then the need to review interventions like the reformation programs, the facilities and services for plea bargainers, especially with the aftercare. I think there's a need to revisit that already as what our group has determined. And the next, the need for budget basis for hiring appropriate professionals. I think this was also mentioned in the first group. It's always about budget. The problem is always about budget. So I think all of the groups are have that challenge as well. The low capacity of PDLs and surrenderers with severe classification to pay for TRC fees and services. So what happens is once they are granted plea bargaining under a condition, especially if they have severe affectation during the DDE, they have to go to a facility for inpatient rehabilitation, right? Unfortunately, like in the part of Cebu City, those PDLs has to pay. They have to pay an amount and upon admission and a monthly amount in order for them to undergo the treatment inside the rehabilitation center. And upon knowing that they have just like gotten out of prison, which financially they are incapable yet, and they still have to pay for the TRC. Um, For COSAP, we have a yearly 1.5 allocation for Cebu residents. Next is the judge ruling, like for the client with ruling for CBDRP, made to undergo facility-based rehab. So it's still in line with the last point. Next is the lack of PWOD availment of services, even free ones. So we are claiming, or we want for the PWOD services to be accessible and available, but unfortunately, there's still a lack of availment of services. That's for free. Next, on the drug dependency exam, fees can be prohibitive. Some clients have been going several times already for DDE. And then the limited capacity of the LGU staff to counter check DDE availment, which means if they constantly ask for a DDE like once, twice, thrice, it could only mean one thing, that they are again asking for plea bargain, right? How many minutes am I at now? So next is the profiling or the upgrading of surrenderers to plea bargainers. So our short-term action points for this, we would love to have a dialogue among LGUs and the stakeholders to bridge this gap. The meeting with judiciary for standards on plea bargaining and to lobby with DOJ when it comes to the conditions of plea bargainers. And then the review of existing policies. Sample of the existing policies would be um, the MCs, the what else? For the resolutions and then the CBDRB program. Explore with DOLE for non-discriminatory protection of employees and the right to employment in due process. Next is the implementation of family skills-based program because we believe that at the end of the day, all PWOODs would eventually go back to their families. It's not only them that's recovering, it's also their families that are recovering. So it would be best if we also implement family skills-based programs. And next is the institutionalization of the BADAC focal person or desk officers, because somehow a lot of barangays just have like temporary BADAC focals or desk officers. So if it's institutionalized, then it would be more effective when it comes to providing or the provision of services. Next, we have medium term. You only have short term. For short term, our timeline for that is about 1 year. So for medium term, it's about 2 years now. So recognition of LGUs with adequate effective job placement programs for former PWOODs, and the inclusion and dialogue with law enforcement agencies, personnel, and judiciary. We would have wanted them to a dialogue with them and hopefully educate them a bit, or right, uh, especially with regard to the compassionate pragmatism. Okay, next for long-term action points. We would have wanted or prayed for alternatives to incarceration. No imprisonment. I know that's that's hard, but you know, hope springs eternal. So we're hoping that there will be alternatives to incarceration. Just let them undergo rehabilitation. Next is the inclusion of medically trained professionals in the barangay level. So the more access to medically trained professionals, the better the services would be. Review and amend RA 9165, especially on the provisions on aftercare. The DDB board regulations, check for relevance and redundancy because we've noticed that it's not any more sensitive to the needs of the current times. And updating the interagency consolidation, include frontliner LGUs in the consultation and policy development. Review framework of drug-free barangay or workplace. That's also the same with the social services department. And change the term drug clearing because it sometimes connotes to be impossible or something like that. So we're thinking if it could be drug compliant barangays instead. And the next would be uniform and streamline the M&E accomplishment reports because for monitoring and evaluation reports, it's different templates per agency. We have a different template or report for DILG. We have a different template or report for PIDEA, for DOH. So we hope that it would be just one comprehensive report for all the agencies. Next, the passing of ADAC or ADAW law to institutionalize hiring of professionals to address the issue of illegal drugs and cascading of services to all LGUs, including third-class municipalities. Because most of the time, even training and implementation or introduction of programs, it will just be in the NCR portion or in the first-class cities or municipalities. So we would have they would want, or our team would want to include even up to the third class municipalities. For the stakeholders, who do we want to engage with for all the plans that we want to pursue? Of course, on the government side, DOJ, Supreme Court, the judiciary, the PNP, PIDEA, DOLE, DDB, DILG, DOH, BJMP, DepEd. And the first time that I've learned about this group, the Union of Local Authorities of the Philippines, that already includes the Mayor's League, the League of Cities, Vice Mayor and all, and of course the SWD. For CSOs as well, like the Rotary, GCI, the professional organizations like IBP, Dental Association, Nurses Associations, faith-based organizations, NGOs, and community-based organizations such as the Homeowners Group. We have solo parents, we have women's group on the barangay level. And of course, the most important sector again, the PWOODs, which are the drug heeders or the reformists. We highlighted drug heeders or reformists because we wouldn't want to call them surrenderers anymore because it connotes something negative. If you surrender, it seems like you have no other choice but to surrender. But if you become a heeder, it's like you're heeding to the call of change. You would want to reform yourself. So drug heeders and reformists. That's all for our presentation. Thank you so much from the Queen City of the South, Christine.
Thank you very much, local government. You know, they were just given 1 hour. You know, the talent of the Filipinos talaga across, you know, you can see the level of input really high. You know, so you can imagine if you do one more week, maybe if you all work together one more month, one more year, I think we can do a public health approach, right? Looking at this output. Okay, let's welcome the last group to present, the Drug Policy and Law Group, with the rapporteur, who is someone who's gonna come in front. Si Sir Danilo ata ang tumalo. Oo nga.
Okay, so thank you, Christine, for summarizing everything for us. All right, so this is my group, the Law and Policy Group. As you can see, this is a group of very intelligent people. That's all I can say. So let's move on to the next slide. Our group was led by, of course, Miss Joanne de Belen and Inez. Where's Inez? So let's give them a round of applause. Ako pala, sorry. Nasa akin pala. The four problems that we've listed down are these, no? Stigma, unified programs and services, criminalization of drug use, lack of aftercare, legal assistance, and high rate of Hep C and HIV infection. Now let's try with stigma. When a person is using drugs, they're stigmatized. No, when people are stigmatized, they tend to have very poor health-seeking behavior, so they don't seek help. So that's a problem. For the unified programs and services, the problem with government is we're all acting sporadically, right? Like the BGMP has its own program, the BUCAR has its own program, Parole and Probation Administration, we have our own program, the DOH has its own program. So maybe in the hope of, in the future, maybe we can come up with a unified program that will encompass every person's needs, especially those who are not, everyone, not including those in the criminal justice system. Now, for the ultimate solution for like the third one, the criminalization of drug use, I think that the best solution for everyone right here is to decriminalize drug use in the Philippines. If we decriminalize drug use in the Philippines, we will have more people seeking help. We will be able to redirect all our resources to helping these people because we recognize that the problem is mental health in nature. Now, the problem also with the government of the Philippines is we always approach things in a punitive nature. Now, if you do something wrong, you get punished by doing that. Okay, so you get incarcerated, prison mayor, prison perpetua, things like that. Now, so the criminalization leads also to stigma of the P woods, and it causes congestion in the jail. So if you notice, if you come to, like for example, the Quezon City jail, it's 800% beyond its capacity. So imagine people sleeping in shifts in the city jail. So some they sleep on the floor, they sleep on the mezzanine with their hammocks, and some sleep on the top, no, by placing just rods in between the windows and the walls. So and we would have less clients in the parole and probation administration because we have been beset by a lot of plea bargaining cases because of RA 9165. And may I point out that it is important that the government change its discourse in the way it cases. Because number one, it's a good thing that a judge from Cagayan de Oro City is here. Now, she pointed out that RA 9165's what's that? Declaration of policy is very good, but the articles, the sections, does not coincide with the general declaration of policy. So we must make sure that they are consistent with each other. And I think that the way that people view drug use as a violation of the law will change if the government takes on a different discourse this time. It should lead the change in in making people understand that drug use is a health issue and not a criminal issue. Now, for the short-term action points, number one, we should develop a unified corrections agency, maybe the creation of a Department of Corrections to put everything in place. The stakeholder consultation with DOH, SW, DOJ, BUCOR, BJMP, and of course we included DBM because they always say, oh, wala tayong pondo dyan. We have no money. Okay. So let's there should be a study on threshold quantity for what qualifies as small amount in decriminalizing possession. Let us revisit the pre-bargaining approach and popularizing evidence behind public health approach to substance use as harm reduction. Now next, the long-term action points, of course, is decriminalization, removing criminal penalties for substance abuse possession of small amounts of currently illicit substances. So those are the sections and the subsections and the paragraphs. Okay. So there should be a policy for community-led response to substance use that is voluntary, unified, and integrated. The next one. So these are just the identified stakeholders. We have for the decriminalization, of course, DOH, DDB, DOJ, the P-Woods, healthcare workers, service providers, and CSOs, and judiciary. For policy on community-led response, we have DOH, DDB, DSWD, the ALG, people who use P-Woods, CSOs. Policy on harm reduction, academe, development partners such as UNODC, DOH, and popularizing evidence with the last one, popularizing evidence behind public health approach. It means that we should encourage more people in the academe to do more studies and maybe in the people in the community to do more studies and publish them so that we can educate more people about the plights of P Woods and that sort of stuff. So we have here, of course, with the help of the media, the National Academy of Science and Technology, and the academe. So that would be all. Thank you.
Thank you very much, Drug Law and Policy Team. That's a very inspiring, a very progressive presentation, I might say. Um, when we are implementing the UN Joint Program for Human Rights, some of you may know this already, but the UN Joint Program for Human Rights is the first of its kind all over the world. So it's the first time that there's a group of government, United Nations, civil society, all working together for reform so that people, communities, and families will have better situations. And all these recommendations are actually representing no, something that I think we can be proud of to show to the world. No? If we really push for all these recommendations, I think it has the Filipino brand of excellence, very, very good presentation. So let's give a warm round of applause to everyone once again. For our next session, we'll be going a bit on a lighter side of the day. No? So we're having an informal dialogue and conversation with some individuals who are pioneers no, in the field of compassionate pragmatism. They are members of civil society organizations who've been working with people whose lives include drugs. No? And I want to call them one by one, and we'll have a facilitated conversation with them. So the first, I'd like to call a representative from I Do Care Cebu, Panky Nadella. Next, let me call on Attorney Cathy Alvarez from Street Law Philippines. Let us all welcome Ms. Arlene Santos from the Institute of Politics and Governance. Let's also welcome retired Judge Corazon Gaitel Yanderal from HUCOM. And finally, one of the pioneers of harm reduction in the Philippines, Ms. Maria Ines Perea from No Box Philippines. You may please sit in the couch. For this conversation, it will be facilitated by our colleague from the UNAIDS Philippines. Let's all welcome Dr. Louis Ocampo. And joining our panel to give a reaction is our colleague from CDC, Dr. Molly Evans. I will now turn over the platform to Dr. Louis.
Thank you, Lee, for introducing the panel session and also for introducing our discussants for this session. Good afternoon, everyone. Gising pa ba? I'm excited actually to share the stage with our resource persons, to facilitate the discussion and to learn from their experiences. I know these people have vast experiences on this topic on compassionate pragmatism. So specifically for this session, we will help us, this will help us understand through actual experience how compassionate pragmatism is being implemented in the local context. Specifically, the session aims to identify and describe services, programs, and responses in communities implemented by civil society organizations for people whose lives include drugs, an example of compassionate pragmatism or harm reduction. And along the discussion, we will also articulate the key principles and elements of compassionate pragmatism that contributes to effective engagement and meaningful changes in the lives of people in the communities with drug-related issues. So let's sit comfortably and start the discussion. So let me ask the first question, and anyone can answer. Briefly, what is the name of your organization and what is your advocacy and general work area? Also, can you give examples of work that you do with specific activities that embody compassionate pragmatism or harm reduction? And lastly, what key principles of harm reduction do you abide by or used in the delivery of your services? Okay, let me start with Ines. Since from my right, going to the far right. Okay.
Mali pala yung inupuan ko. Okay. Hello again, everyone. So, just a quick background siguro or kung sino si NoBox. So, NoBox is Philippines is a nonprofit organization, of course, and we basically exist to advance the rights, dignity, equity, people whose lives include drugs, and we're doing this through advocating for reforms in our drug policy, drug laws, but also in removing the box of conventional thinking around drugs and drug use. And we've seen how that has been a barrier to a lot of things that we want to do. Ano yun?
Samples of your work.
Examples of work, kasi it's a lot of advocacy work. I think siguro, um, okay, one of the things, ang dami, no? I don't know where to start. But essentially, I think one of the things that we've found ourselves doing a lot of is having conversations around drugs and drug use, right? So during the last administration, for example, we've done a lot of workshops, parang drugs harm reduction 101. And the reason I'm saying this is because it was also a parang humbling then in getting to engage with local government officials. It's a lot of work. Drugs is a complex issue. It doesn't have to be complicated, but of course, like a human experience, it's complex. And you're talking about people who are already doing a lot of things, right? Apart from this. But I think the recognition, and what I really appreciated with the work with local government is how nandun yung puso eh, right? And you know people who are being at the, paano ba sabihin? Yung sila yung naging kawawa, kumbaga, with the actions we've been taken against them, right? And what we've seen is that what has been limiting also has been how drugs and drug use has been understood. So we've worked with some LGUs, for example, where when we broke it down and then really have a space for everybody to share experiences, and we're talking not only about people using drugs, but also about people who are trying to figure out what to do. Then understanding that it's not about drugs, therefore effects. So this is a call to the drug education that we have, that we need to kind of revisit and change. Because there's always the thinking that drugs, therefore ill effects. That's not how it works, right? So drugs are inanimate objects, and we have to look at it in terms of set and setting. So there are a lot of factors that need to be considered, and it's a lot of intersecting issues. So I think in a way, it became liberating then for those who are responding. We've had also workshops with teachers and dep coordinators sila, but knew admittedly zero about drugs. And so it was very helpful. So it's even empowering for those who want to provide services. And then the other thing, siguro, because we also have engagements in the community, so communities, localities, but also communities, people whose lives include drugs. And so siguro one of the things that I want to share is this whole notion of voluntary. What is it really? And also, do we need all these lists, barangay lists? Kasi ito yun eh. 'Di ba? Ang notion kasi is we need the lists so that we can connect them to services. Pero hindi kailangan. Because we've seen it from our experiences, from our engagements, right? If we create the spaces where they feel safe to come, where we actually figure out together with the people we're trying to help what services would be helpful instead of dictating what we think they need, but really figuring out together, pupunta at pupunta, right? So we have had engagements where they may not, these are people who were actually on the lists, who would not show up in any barangay programs because of the list. They're exposed and all of this, right? But if you create the spaces and they would come, walang pilitan. No? So what happened is, for example, the first thing that we did was to have a conversation around it. Diba? So there are questions. What is expected? What can we expect of this? And then from there, when we had, this is an example lang, no? We had regular sessions. And then some of them wouldn't show up for the first few meetings. So when the local government found out about it, sabi nila, nako, we'll send them a letter and tell them to go. And they said, no. If they're not coming, there's a reason for it. That's fine. They know where we are, right? And bit by bit they came. And that's also culture, di ba? Patanong-tanong. Paano ba yan? Pasilip-silip, you know? Try to see, wanna ask questions. And then, kasi mahaba ako magkwento, no? So, the idea was, from the coming, uupo, tahimik sa gilid. Tapos, later on, magtatanong na, later on, proactively, and already exhibiting some kind of leadership. So, yung ganon. So it's that, and a lot more, but I have for other people.
I can feel the passion, Ines, and it translates to a lot of work that you're doing. And thanks for sharing, the strategy and pushing the agenda, particularly with the local government unions, right? I understand street law, Attorney Cathy has been helping our community in providing legal support and other things. Can you share more of that?
Hi, mayong hapon. So, Street Law PH it's a small legal service organization working for humane drug policies and access to justice for our communities. So we work with communities of people whose lives include drugs, including women who have been incarcerated for drug-related offenses. So with the support of UN Women, we were able to conduct paralegal trainings among women in detention in at least 4 female jails in Cebu, Lapu-Lapu, Mandaue, and Talisay cities in the province of Cebu. So that's just one of the things that we are working on. But I think it's important to point out that in the course of our work with women who are in detention for drug-related offenses, it's very clear to us that one of the most harmful things that we as a society have done to people whose lives include drugs is to send them to jail. And so that is what Street Law PH is trying to work to take back. So we are trying to teach women who are detained to navigate the legal system so that they can help themselves as well as their fellow women to learn more about their cases so they can push back and find a way for them to be released from detention. And also, we've also engaged with institutions in the legal system, including the judiciary, including the integrated bar, to also convince them that and so it's very important for us as we work. For me, one of the most important principles of compassionate pragmatism that we try to always keep in mind is that we are just service providers, we are supporters at the forefront of our work towards policy change, our work towards access to justice, bridge them towards what services are available, including, for instance, making sure that during the COVID-19 lockdowns in the detention facilities, the women are able to access their families. It's not us who will dictate. It's not the lawyers who will say what needs to be done. We are there to guide them on what the laws say, what the legal procedures say, but the real experts on drug policy, the real experts on drugs and drug use are people whose lives include drugs. And that's very important for us to emphasize and to always keep in mind in everything that we do, in all of the programs and all of the activities that we try to work on as Street Law PH. Thank you.
Thank you, Attorney Cathy. Our legal system, just like the other health systems, like health system, is one of the areas that is very hard to navigate, and your organization is serving as a compass for those people who's trying to put their life back on track. So, thank you so much. I do care. I think I do care is one of the organizations providing services, particularly integrating HIV services and drug reduction, harm reduction services. Can you share more with us of what you do, Panky?
Yes. I Do Care is a community-based organization for drug users. They are productive member drug users. So Yeah, let me start by our services is on they are outreach worker. They started an outreach worker and HIV program from the Cebu City Health. We're the leg worker of the City Health and HIV program before we started there. And when it comes to how do we started in the program of needles insurance program. The component of one of the harm reduction is the needles insurance program. We access that program, that services since 1995. So there are outreach. There are give. I don't know why. I know how it started, but there are already services of needle insurance program in Cebu City in 1995. There are outreach worker. We access that services. Curious about it. We didn't know yet it's harm reduction. We thought it just services and harm. And they're given a wound care. So my ointment yun. Then every time the injectable drug users in that certain place will be given a wound for their needle marks para walang marks or something like wound care. So that's part of the services. So we're curious, but doon kami nag-start because of that component of service. So and we found out we volunteered in a HIV program. It was at HIV program time. So we volunteered at the time. Then in 2015, we decided to have a community-based organization, which is I Do Care. And now we already have I Do Care runs now a community-led drop-in center. So what are there in the drop-in center, in the community drop-in center is that we gave, it's a safe space for drug users. We're giving them HIV treatment, hepatitis C treatment, testing, awareness, learning group sessions. It's a safe space for them and paralegal services. And aside from that, motivational interview because the interviewing, they are trained also there. So there are lots of menu of services for drug users in the drop-in centers. And now we have at first at first when we started a drop-in center, it was just an outreach worker who is running. Now we already have volunteer doctors and volunteer med tech doing outreach work with them. So yeah, so that's I do care.
Thanks, Punky. Your contribution to the program, not only to HIV, is very valuable. Right now, it's being funded by Global Fund and other support coming from other partners, right?
Yeah.
I'm just curious, how do you envision I Do Care in terms of sustainability, in terms of partnering with government, to continue your services? Ano yung plano natin? Ano yung nakikita mo para sa I Do Care?
Yeah, I do care really wants to run sustainability of a drop-in center where there is a comprehensive package in a harm reduction, like we just we're just so focused sometimes on HIV. So maybe the comprehensive package of not just on HIV, like the medical assessment treatment, withdrawal management, and other and needle insurance programs in a one drop-in center. The problem, the challenges is also how to be funded with that because we're a drug user community. It's very difficult to have funding when a group of drug user community, and yeah, the sustainability. Yeah, so that's the challenge. Yeah, but that's our what we like to see for years from now, parang stable,
Okay.
sustainability of the services. We established already the first, yeah.
Thank you, Punky, and I commend you for leading I Do Care.
Thank you.
Okay, let's go now to Judge Corazon Caite. As Okay, kayo na po naman. Sorry. Kay Ma'am
Ako si
Arlene
Arlene
Santos.
Santos. Okay.
Sorry. From the Institute of Politics and Governance.
Okay ding maging judge. Sige, magandang hapon po. Yan, Judge Arlene. Sige, from Institute of Politics and Governance since 1994, IPG's work is focused on partnership with local government officials and civil society organizations. The main core of the program is participatory and transformative local governance, gender responsive governance, and health governance and harm reduction. But our harm reduction work only started 2017. So medyo alam na natin why. Because at the time, our partner LGUs are at a loss which policy, which pronouncements they will adhere to, they will implement, which policies they will navigate because they're not comfortable with it. So all those things, you know what I'm talking about. But first, IPG story on harm reduction, it's a shared story with our partners from Antipolo, kaway-kaway naman dyan, Antipolo City LGU, and Marikina City LGU. Maraming salamat. No? Our story, wala kaming storya sa harm reduction. We don't have a harm reduction story without them. No? And of course, no backs who we are just kids sa harm reduction. Sila talaga yung gumabay sa amin and nagturo, no? Who taught us harm reduction. So we navigated, no? 2017 we started. We know that the national government and using the Data Privacy Act. And eventually, we focus on some pilot barangays in the two cities. And we established the care teams. This is the third, those who are familiar with the BADAC, there are two committees, right? The operation, who's with the PNP when they do operation work, and the education or campaign. Through executive orders of barangay captain, we established the care team. It's a committee, no? Social services committee, because they recognize in the barangay that the BADAC is recognized is known more with the law enforcement, not on the community rehabilitation or taking care of clients, etc. So they said, let's put up, no, it's their proposal, let's put up a third committee. It's not illegal anyway. It can be allowed. So those are the care teams. So in the care teams, of course, our first introduction always with partner LGUs was harm reduction workshops, no? Because there's the orientation must be established first, the foundation. And then of course with the care team, we did capacity development, like the motivational interviewing, joint goal setting with the clients, no? Case management after the joint goal setting, legal and health clinics, because that's also what we did, because we know that harm reduction must be a holistic approach. So we have our legal team and health team. Dr. RJ is part of our health team, providing legal and health services and clinicking. But at the end of the day, especially in 2017, early 2018, the bottom line of our harm reduction parameters are, wala dapat mamatay sa kanila. You know, the program should shield them, no, for them, not any of them to get killed. So that's the bottom line. And then of course the caring part. The pandemic hit this program hard. Because our partner, our frontliners, all the resources, all the focus, nawala yan, no, from other program. Nag-focus yan sa pandemic response. Kahit kami ay nag-shift sa pandemic response together with our partner LGUs. So yung aming pilot batch with the LGU, hindi natapos. And now we're back again, and more focus on the city level also on community responses.
Thank you, Miss Arlene. I think your partnership with the Antipolo and Marikina City is one, good practices, that we have. So I hope you have plans to expand these partnerships to more local government units, right? Oh, okay. And now, see, of course, the last but not the least, from Hukom, from Judge Landera.
Hello, good afternoon. Before I start my sharing, I just want to make a bit of clarification. Although I'm introduced as Hukom member, I would like to speak here in my own personal behalf because Hukom is actually a group, an organization, a SEC-registered organization of trial court judges. So unlike myself, who is already out of government, I retired last year. So all the members of Hukom are still active in the service. So Hukom is not a CSO. So I'm here as a personal CSO in my personal capacity as a plain citizen and advocate of harm reduction. I think of this in this group, I'm the youngest as far as harm reduction advocacy is concerned. It began in about 2 years ago when I attended a seminar organized by Street Law and NOBOX with IDUCARE participated. The culprits here, they introduced harm reduction to our group, the Hukom judges. And then after that, they invited me to attend the Harm Reduction Summit in 2021. And I always remember this, that one striking takeaway for me from that seminar was a line that I heard from Chris Nairo of Law Enforcement Assisted Diversion Program based in Seattle. He said that in his vast experience with lead, he said that the criminal justice system is the source of a profound harm for people who use drugs. That really struck me to the core. You know, I have been a drugs court judge for 12 years. From the time I was appointed in 2010 to the time I retired last year, I was handling solely, exclusively drug cases, day in and day out. So my day job was, signing detention commitment orders to send people to the jails. And so, yeah, that really struck me. And I guess it cemented my decision to retire and pursue advocacy for harm reduction. Because from my experience, it's really the situation right now in our jails is of crisis proportion. We are here very comfortable, but you know that in our jails, we have one of the most congested jails in the world. And when I was preparing for my presentation to that summit, I constantly was in touch with our jail in Cagayan de Oro, and they were giving me figures. At certain points, it reached as far as 2,000% congestion. And I asked them what is the rate of death in jail. When I was still a judge, there was a period, there was an average of 2 deaths per month in the jails of Cagayan de Oro. So there. And I said, this cannot go on for me, this kind of job. I'd rather be out there voicing out my own questions regarding this law that we are implementing. I'm talking about RA 9165. One particular question is, RA 9165 was introduced, was made in 2002 to amend the previous law, RA 916425, and imposed really stringent, higher penalties. And I said, after 21 years, so 2002 to 2023, why is it that we have more and more drug cases being filed?
it's as if the law is not effective. It's not effective as a deterrent. You know, it's supposed to deter people from committing crime, etc. But anyway, because of that seminar also on harm reduction, I began to look at the law from a different lens, and I began to see what the to see the provisions of a law from the very different perspective. Like for example, if you look at the law from a criminal law perspective, you will look at relapse from a criminal law perspective. You will impose higher penalties the next time because it's called recidivism, habitual delinquency, etc., for which the law will always impose a higher penalty. But if you look at it from a harm reduction perspective, relapse is part of a whole process, right? So there, if you don't change your perspective from just merely criminal law perspective, I don't know what will happen. I guess that is why we still have this problem and it's getting worse. So anyway, as having regained my private citizenship, what do I do now? Um, what's this, North Star? My inspiration for me is always, of course, the youth. So I'm now back to supervising law students, introducing harm reduction to law students. And again, with the culprits here, I've introduced, and they're very receptive. I'm beginning with Cagayan de Oro, where I'm based. I introduced this to challenge to the law students of Xavier University. I said, you look at the congestion problem of Cagayan de Oro, and you will know that it is related very much to the drug situation. Why don't you do a research and tell us what is the exact drug case situation in Cagayan de Oro? And in challenge ko sa kanila, at the end of your research, let us present the fruit of your research to our congressman, our congress representative, and tell him, oh, what will you do with this problem of Cagayan de Oro, this situation? Because we have a very famous congressman from Cagayan de Oro, is very vocal in the Congress, Rufus Rodriguez, diba? And sometimes he has filed actually cases related to the drug situation. So it would be good to have, law students, fresh-faced. You have done interviews with people who use drugs, who have done interviews with probation officers, with Department of Health, community service providers. If they can tell our congressman, this is what is happening in Cagayan de Oro, what can you do about it as a lawmaker? So, and fast forward with that experiment, which is beginning with that, I already have another judge who is also teaching in another law school up north in the Cordillera who would like to replicate. He said, I'm teaching law in Cordilleras. I'd like to do the same thing. I want to challenge our students. I want them to be useful. I want them to see the situation and then, contribute. Because if you look at the reports earlier, there were a lot of, suggestions for law reform. So my personal advocacy now really is to promote conduct of researches so that we will have evidence that will inform the new laws that we want to implement in our country. So thank you.
Thank you, Judge Corazon. And we need more judge like you.
Yeah, we have a lot.
And hearing your story and your realization and the change of heart in terms of your perspective, it's really an inspiring story. Thank you for that. I realized that even before the compassionate pragmatism came in the country, hearing from all of you, we are already doing it in some forms, in some degrees, right? So, but I think we, despite all the successes, I'm sure we have a lot challenges. So at this point, I want to know, and we have all people participants here who might have some inputs as well in terms are we going to address the challenges that you encounter. Let me start with you, Ines. Challenges that you have in terms of doing your work.
Very basic. This whole obsession with being drug free That's the greatest barrier, right? No, it really is. And this is not just being ideological or anything about it. If you have service providers who recognize that we should not be cutting off people from services, especially those who need it the most, tapos in the drug test, ira-random drug test, surveillance drug test, which eventually ends up them being separated from the services that they need. Is that tama ba yun? Di ba? So that's the whole idea. Why focus on drugs? Instead, why don't we focus on people, right? What do we need to do to create a supportive environment for people whose lives include drugs, right? It's more that parang shifting lang. We talk about relapse, but yet sometimes we talk about it as if it's a bad thing. UN World Drug Report, UN itself, 87% are non-problematic. Non-problematic using drugs. No substance use disorder, no harm to self or others, diba? So meaning if there are problems, if there are in a situation where there are problems, it's unfair if we just blame the drugs, diba? It's unfair to them, it's unfair to the families. Diba? Kailangan, let's really look deeper into it. Ano ba talagang nasa loob ng tao? Intindihin talaga natin. That's who we are naman as Filipinos. So that whole drug-free narrative has to be revisited because it's limiting us from providing the needed services as well, and then putting others in greater harm. Siguro one point lang, for example, there really is nothing controversial about helping people and saving lives. I will clear yon. But it is really morally wrong if we are depriving people of services because we're just making judgments based on, di ba, yung ganon. So, pero as a Filipino, as Filipinos, ay nakikita ko naman like how we are a caring community, as you said. I just came last weekend from a session with volunteers who want to help. It's within us, di ba? And that's what I say, na drug-free naging sagabal because the focus becomes on the drugs instead of helping people. So yun yung basic, and that's that's something that we really trying to also address. Parang ganun.
And that's a big challenge, Ines, right? Considering the context that we have now. But we are very optimistic, in our collective efforts that that major challenge will be addressed in our lifetime, hopefully. Exactly. Anyway, Attorney Kathy, what about your organization? What are the challenges and how do you overcome those challenges?
Overcome. Legal system. For every judge ason, there is also so many members of the judiciary who actually believe that what they are doing by sending people who use drugs to jail is the right thing. In the same way that for every public attorney who is overburdened with too many cases, there are also people who think that the only is to, we have a term for it in Cebuano called tagam. It's like teaching people a lesson. And yet, where is the compassion there, right? And so the challenge for us really is that our legal system is designed, our law is designed in that all it provides really are penalties. It's just a list. Cool. And it's very difficult to overcome this kind of thinking that our role is really just to make sure that the law is followed. And so I'm very, very thankful that we have a generation of law students who are now exposed to people like Judge Azon, people with like Professor Lee, that just because something is legal, it doesn't automatically mean that it is just. And this gap between what is legal and what is just, we have an obligation to bridge that gap. If that means changing the laws, then so be it. That part of our role as members of the legal system is to push against oppressive and unjust laws and to work to change them. And so I'm very looking forward to the future, to our law students of the future who, unlike our generation, who only had to memorize and parrot back the laws, we actually now have been able to create spaces where law students, future lawmakers, future policymakers, future members of the whole legal system are provided with a space to interact with people who are the most affected by the laws that we have now. And this is also what we are trying to do with street law, to try to create safe spaces where communities of people who use drugs are able to share their experiences, share their expertise with those who are in the legal system. And we saw how this is with what happened with the role of Hukom and Judge Azon. And we hope to be able to do this among the other legal system institutions as well. And so we want to have prosecutors, justices, judges, public attorneys to join us in saying that enough is enough. Our present punitive laws, our present prohibitionist policies are not the solution that we used to think it is. It has, in fact, created more problems, that has resulted in more egregious human rights violations that many of us here are well aware of. And it has also created an environment where human rights violations are incentivized. And so these are, ang hirap, no? Jurassic Park talaga. So these are the things that we, not just street law, but all of us who are part of the legal system, including local government officials, actually also all of us as a community, as part of the community, we have an obligation to overturn the policies that allow so many violations of human rights to continue to happen. And I hope that between thinking of what is legal versus what is right, we remember that at the core of all of this, like Ines always says, it's really not about the drugs. It's about how we take care of each other as people. So, and now I'd like to pass the mic on before I cry.
Thank you, Attorney Kat. I can imagine the Jurassic Park that you are describing. It would entail collective and consistent work. But I think the audience is rallying, we are backing you up. You're not alone. Okay. Panky, what are the challenges of I Do Care at this point?
Yes. The challenge is really is the 9165.
Okay.
It prevent us from helping make us a criminal in under that kind of law. Let me taking care of each other is criminalized.
Mhm.
Something like that when it comes to 9165. So yeah, so I think that's the main challenge really is the 9165 in a organization of drug users because we're a criminalized kind of community. So yeah.
It negates the principle of brotherhood, of solidarity and connectivity,
Yeah.
so to speak. Thank
Yeah.
you, Panky.
Okay.
Ma'am Irene.
Arlene.
Eileen, sorry.
Kanina ka pa. And I love
Sorry.
you. Paano ba? I
Wala
want
sa
to
script ko po kasi yung name. Sorry.
Oo nga, it's okay. Joke lang. As I said earlier, we work with LGUs. The legal framework is very important to them because they implement the law in a way in their localities. So we really need to change our law, especially RA 9165. Kailangan na talaga. So we know that it will be difficult. Pero kasi bara talaga siya. Marami naman pag nabago siya, mas madaling magtrabahuhin yung ibang aspeto. But equally problematic is the dominant narrative. The dominant narrative that causes stigmatization. sobrang dominant ng narrative na nakita natin during the war on drugs. Okay? Na hindi naman nagsimula doong panahon na yon. No? Dekada na actually yung narrative. Yung kwento na yon tungkol sa drugs, about drugs and people who use drugs. No? So it will be very difficult to change that. But we are working on that, Tetay, no? Yung si Attorney Tetay, ini-head niya yung aming communication project. But at the same time, it must be large scale, yung engagement about communication, about narrative building, about, kasi nandito yung mga partner namin LGU, mag-agree naman kayo, alam niyo naman ang ating, you know that our elected officials, they're very sensitive to public opinion, all right? They're very sensitive to public opinion because they need to get elected every 3 years. And as long as the dominant narrative is that it don't help people whose lives include drugs, no, you will lose votes.
Right.
No? So, and the changes in the law will help reform-oriented, human rights-based governance practitioners in local government. No, so it's all interconnected. So actually, I'm happy with this activity because we have national government agency, the OJ is open to dialogue, because the LGU will follow. No, whatever the national policy and the directives would be, the LGUs will follow. No? So it doesn't mean that it will automatically change the narrative or the mindset of the people in the community. That's another work, no, for all of us. But yung mga major barriers, pag natanggal or nabawasan, it will make our work more realistic and doable.
And the stigma and discrimination are prevalent, in this country. And I think yung effort natin in terms of, educating people, kailangan pa natin palakasin, no? Because that's the only answer, I think, with stigma and discrimination happening is the lack of awareness and education. Thank you. Judge Corazon.
I don't think I can add any more. They've really identified, I think, the two most important challenges, the most challenging things we face is really RA 9165 and how to amend it, how to convince people that needs amendment, and the narrative that supports this law. And it will take a lot of work.
Thank you, Judge. And I believe at this point, we have said a lot to describe your organizations and what you do, your contributions to our cause. So if we have, we don't have much time to open the floor for question. I will now turn you over to Molly to synthesize and provide some reactions. Molly?
Thanks, Doc Louie. Thank you to all of the panelists. I really enjoyed this, and I think we all share something in common. And what that is that we've had the opportunity to get to know people who use drugs on a personal level and listen to their stories and be guided by them. And it's changed our perspective and changed how we see the world. And I'm really inspired by how you are teaching the new generation of law students. And I think that I benefited in my medical training as a physician from having mentors just like you. And, I did my medical training at a busy hospital in Boston where we were at, the beginning of the opioid epidemic in Boston. And I had mentors who taught us to see our patients as humans and to listen to them and get to know their stories and not put up that medical barrier. And I learned motivational interviewing. And I also was given a tool, and that tool was medication-assisted treatment. And I was given the tool to be able to prescribe buprenorphine to my patients, and I got to watch them recover, and I got to watch them relapse, but I also got to see them regain their lives. And so that was very powerful for me, and that's why I care passionately about this topic area. So I think the themes that I heard from everybody are, first of all, the importance of listening to people who use drugs and getting to know them as people, not just as a problem or a population or a demographic, but really listening to them. I think the next theme that I heard is the importance of working with local government and also educating. And I think that if we all of ourselves in here to take the time to have those conversations, with people who are using drugs, people who maybe are going through the criminal justice system, but actually listening to their stories. In Boston, we used to talk about how every person, and this was in the context of homelessness also, but each of the people that you were meeting is somebody's child, is somebody's sister, somebody's brother. They're people who care about them. And here where family is so important, I think that's an important thing to remember, that these people are loved by someone and so you should meet them where they are as humans. One thing that has come up, but I didn't hear a lot here, is just about the role of trauma. And I think trauma is prevalent, and people who have experienced the criminal justice system have experienced trauma. Most people who use drugs have either experienced trauma in their childhood or are ongoing experiencing trauma. And so from my medical background, I think of the importance of trauma-informed care. And I think that trauma-informed practices should be the best practices and at the forefront of how we engage with people who use drugs. And then I think just finally, because I know it's getting late, but just the importance of all of us working together and to continue these conversations and bring together all of our diverse groups to have these conversations, to change our minds, to learn from each other, to see things in new ways. I think that's the best way to go forward. And I'm so happy that I got to be part of this. Thank you, Milos and Kathy and Doc Louie, everybody who invited me along for the ride. I've really enjoyed it. Thanks.
Thanks, Molly, for summarizing it very well. I think we've reached the end of our session, but I believe we have accomplished our objectives for this one. At this point, I want to thank everyone, Ines, Attorney Kathy, Punky, Arlene, baka magkamali ako, and Judge Corazon, and of course, Molly. What I learned a lot today. I mean, because my background is on HIV, harm reduction and drugs is just one of the other stuff that I do on top of HIV. So just to summarize what I learned that compassion is the inspiration for making changes, but pragmatism and practicality allow us to make the changes happen. So again, thank you for your participation.
Friends, colleagues, let's give one more round of applause to our panelists. I think they made a tremendous good job. And I think there's a request for a photo op. We're down to our
That's just a bit Q&A. Do you think that's better? Just in case we want to ask something. Yeah. Just close it up. Any other presenter? You're just bring us back. Maybe. Yeah. Maybe you can take the lead to answer the Q&A, but it doesn't have to be just they want to ask from even from the panelists that can be considered. Is that okay? Sure. Yeah. You want to facilitate? I'll do that. Yeah. We'll do that. Okay. We'll do short time for Q&A and then we'll sit and then I'll open it for everyone. Yeah. Okay. Thank you. So we should we come? Not anymore. Not anymore.
So at this point, harm reduction, I'm trying to gauge the spirit in the room. I think we've come to the point where we need to digest everything that we've learned. No? There are a couple of sessions still, but I've talked to our speakers. I think it's time to close the day. But there's still a space for maybe let's give 10 minutes for a question and answer. I think it would be good to wrap up this day with some more space for conversations and dialogues, not just with the previous session, not just with Pat and Jeannie, but maybe an open floor discussion for everyone before we close the session. How does that sound? So we might end a little earlier today, okay? So at this point, I'd like to open the floor for any insights, any questions, And that question can be addressed to any of our speakers or any thoughts or reactions that you might have for the day before we do our closing messages. Maybe we have space for 3 questions or comments from the participants. No questions? Everyone's excited to go home? That's fine. In that case, then, I think we can proceed with the closing ceremonies for today. I know that we can start with a closing message from the co-chairperson of the Technical Working Group for the Human Rights-Based Approach to Drugs. Mr. Olivier Lermet is our Senior Policy Advisor at UNOTC, and he's give his message on behalf of the TWG.
I won't talk on behalf of the TWG because I should have a concerted message together with the Dangerous Drug Board, and we didn't have time to do that. First, I wanted to congratulate for the nature of the discussion and the participation. And I just wanted to clarify something. This is not a cult that is taking you from day 1 and releasing you day 5 as harm reductionist, convince people. No, no, no. This country is still a free country. We can still have our own individual opinions, right? And as a father, it may surprise you considering what is being said. I don't want my daughter to ever get close to drugs, okay? But I don't want my daughter to ever get married to anyone. I want my daughter to stay 14 years old, perfect as she is now. That's things that make it maybe not a realistic perspective. So as a father, and some of you may think, I want righteous education. I'm correct. I don't want people to do bad things, including using drugs. That's an acceptable school of thought. Now, as a parent, I never want my daughter to be in risk of overdosing because she has been using drugs without me knowing it. I want her to get people telling her, well, better not use drugs. But if you do, avoid doing that, and do this. And it is interesting to see that the movements that would be associated with compassionate pragmatism have been started sometime by peers, by people who use drugs. Sometimes they have been started by cops, by police that were just sick and tired of going to the same street, arresting the same people, getting them to prison and getting them back in the street again. They have been started by mayors, local governments. So this is not, again, a way to impose anything to anyone. This is just a way to try to share. Oh, sorry, they have been started by retired judges. Judge Corazon, you broke my heart, if I may. You were fantastic. Who are you? Judge Corazon? Ason? Okay, she broke my heart and then she left. Ah, no, she's here. Your intervention was also that. I'm a judge. I have to get sure that law is enforced, but I don't want to be acting as vengeance. I want justice. And what is happening is not justice, because we are sending youngsters to pre-trial detention for 10 years here. If they are in the wrong situation with the wrong people, whether they are using recreationally or not, they can stay up to 10 years. And then, sorry, you are innocent, right? And for those who don't know the prison and jail in the Philippines, that's really not the best way to not become using drugs, right? This is a confined setting, very overcrowded, very difficult. So the point of that discussion here is not to impose things, it's just to try to look at the evidence from here. We have some evidence already generated here from other countries, and to make a model that is going to be suited to the particular environment of the Philippines, right? So for this, in that job, we, the organizer, let's say the United Nations, we are here for you guys, right? From OHCHR, UNAIDS, WHO, and UNODC, we are here to play the role. We are honest broker. We don't have an agenda apart from disseminating the good practices and the standards and trying to put generally a blue flag and people around the table. This is what we do. This is why we were created. And sorry, it's a little bit self-serving, but when I say we are here, is we have been here very actively. And I just wanted you to give a huge round of applause to the team of UNODC, starting by Sheila Marquez. Stand up. Milos. No, stay. Jocelyn, where are you? Stay. Ria. Jill. Okay. Jill. Yes. And to finish, please, probably, oh, sorry, Joanne Debelin. I'm going to pay for what I just did, I know. And let's finish by the unique, irreplaceable Dr. Professor Lee. Dr. Professor Lee, what else? Yarcia. The outcomes of the discussion, I repeat, no censorship. All thoughts, all opinions are welcome because this is a reality, right? It's not a monolithic group of persons that are going to stand up and go and attack the parliament. This is trying to get science and being compassionate and pragmatic. So thank you all and good luck for the rest of this activity.
Thank you very much. And of course, Olivier Lermet, the Senior Policy Advisor. I'd also like to call a very important partner of the UN Joint Program for Human Rights, our partner from the OHCHR, represented here by Mr. Andrew.
Thank you, everyone. And thanks for allowing me the opportunity to speak at the closing today. I think we've had some fascinating and insightful conversations here today. And I wanted to particularly commend DOH and our government stakeholders for using a rights-based framework and a rights-based framework for persons that use drugs. I think it's important to acknowledge that people who use drugs don't lose their human rights. And we've discussed here the importance of harm reduction within a compassionate and pragmatic framework. And that we should remember that harm reduction forms a key part of a human rights-based approach, along with proportionate sentencing, alternatives to incarceration, ending the prosecution of children for drug offenses, ending the stigmatization and discriminations of people who use drugs, protection of indigenous and religious practices, and of course, ending impunity and seeking accountability around extrajudicial killings and the torture of drug suspects. I also want to echo Gustavo's comments, where he presented the work here today as a step forward in the way that we view substance abuse and seeing it as a public health challenge within the Philippines. The importance, I also want to highlight the importance of local level engagement and the importance of this program that I represent as well, which is part of the joint program under the auspices of which ODC are also delivering the human rights-based approach to drugs. It's also worth mentioning that this program has a lot of support from the international community that was represented here today by Australia and Norway. And that's an important part and aspect of advancing approaches to compassionate pragmatism within the Philippines. And today we heard from colleagues from across government, from civil society, and many of you participating in this room. And I was particularly struck by the comments around the importance of nothing about us without us, and the long-term efforts to bring in stakeholders of law enforcement, people who use drugs themselves, and government within a harm reduction approach. I think viewing drugs as a social, not criminal issue is vitally important, and and also contributes to the powerful idea that the opposite to addiction is not abstinence, but connection. I'd like to encourage everybody here across national and local government, friends within the UN and civil society to continue your work together here, working across sectors to build capacity, to build partnership, to pioneer approaches, and to place compassionate pragmatism at the heart of our approach as part of a wider effort to strengthen human rights here in the Philippines. I wish you a good and productive collaboration for the rest of the workshop, and I very much look forward to working with all of you going forward in the months ahead. Thank you very much.
Thank you very much, Andrew and OHCHR, for the support for this activity. We want to end this session with a sort of a vision, ways forward for everyone of us here working for the public health approach to substance use. And to give us the final message for today, I'd like to call on Assistant Secretary Beverly Ho from the Department of Health Public Health Services team.
Hi, good afternoon. Good afternoon to our dear experts here, our partners from UNODC, UNAIDS, CDC. Hi, Molly. And I also saw our CSO partners, Ines, I Do Care team. Magandang hapon po sa inyong lahat. And syempre, DOH colleagues. Maybe Jude has already shared with you our overall directions, but it is important to let you know how we plan to move within the health sector. You know? So at first you might think, okay, we're now down to actually there are two persons now working on this portfolio, hopefully more in the coming months. But I think it's very clear to us that we don't want it to be a siloed program again within the DOH. And we think that the more offices in the DOH who are going to be participating in this reform from prevention, promotion to service delivery will actually be better for us, because that means that we are recognizing that it's not a unique service that will be a reason for it to actually be stigmatized, right? Because it's part and parcel of primary care, Doc Jazz, and it's part and parcel of mental health. So that's really the way we want to approach it. And definitely the Health Promotion Bureau headed by Director Rodney Carza here, also with me, and Jude and Benjo and Allen. The idea really is to shepherd the process, but not in a way that alienates the other offices. No? So if we're talking about modifying service standards, then we have to engage the bureau that works on all standards for all health facilities, right? If we're talking about modifying clinical practice guidelines, we talk to the bureaus in charge of making those guidelines. And if we're really saying that this kind of service is well within the ambit of mental health, then we are looping in the team inside DOH who's working on mental health. No? It doesn't mean that just because we now are just two full-time people working on this, it means that we are less committed to it. But we feel that the time for when drugs is here and everyone, anything that's drugs, we don't want to look at it, let's just give it to that group. That has to be over now. No? So more people within the DOH has to own and understand the direction that we're heading to. So that's the governance and management part within the DOH. But second, more importantly, is I think it's recognizing that there's an opening within this administration to work on even difficult things, um, because there's a recognition that a new framework for approaching things is going to be embraced, no? And we want everyone to be hopeful, but also at the same time to recognize that it's actually a spectrum that we're working on, right? So I think the fact that this this workshop is entitled Compassionate Pragmatism as opposed to a regular terminology of harm reduction already recognizes that people, policy people, implementation people all lie within a spectrum. And we want to be able to bring people along. And at this point in time, really not immediately repel, no, those who actually we might be able to bring along. No? So just do know that maybe what really binds us all together is the recognition that and the respect that we have for the human rights approach. We're always on the same page on that. But how we will approach it, how aggressive we will approach it, I hope you will understand that we will also be not really taking our time, no, but be very, very strategic about it. In fact, next week we will be meeting our colleagues from DILG. So USEC Marga has agreed to have a meeting and will bring in our DSWD counterparts also. Because I mean, definitely you have been seeing that they're also moving towards a different direction, right? DILG. But you also see that there are pronouncements, right? That are not also really entirely still I guess in consonance with how we probably in health sector would view it, no? Say drug place, workplace testing, etc. No, so there are things that we know we have to, and we count our blessings that people have moved from one side to another, but we cannot expect that it's complete 360. No? So I think that's where we will need more guidance, support from all of you as we bring along different sectors in this journey. And probably my last point is really wanting to emphasize that while we want to maximize the space or the political window that we have, we also just want, and I kept talking about this with Lee and Olivier in Vienna, that we want our implementers, the very few of you precious implementers, to always be safe. No? And that means we need to recognize the, the current legal framework. So the only way we could be as bold as we can is when we couch our work in the context of research, right? And I am very, very proud of many of you who have been really, really brave from last time around until now. But I think we also need to make sure that you will have more time in this world to do what needs to be done. No? So it's really asking our partners to help support more implementation research. And in that way, you will get our full commitment to have this approved in the DDB board, because we really need to make sure that those who are doing the most progressive work in the country are protected. And at this point in time, without any change in the legal framework, the only way to protect you guys would be to really couch the work as research. No? So we have ethics review committees, etc., etc. We and our development partners, PSFI pala, hindi ko nalalo, should be able to help you out. No? So I guess those three things are critical for us. Rest assured that we, Director Rodley, Jude, and the rest of our team, we will work as hard as needed and continue to engage with our fellow government agencies to get us to where we need to go. So maraming salamat po ulit.
Thank you very much, Bev. Bev, may I ask you and our DOH colleagues to just stay in front together with Olivier, with Andrew for a photo op. Alan, Rodley, Jude, Banjo, and did I miss anything from the DOH colleague? And maybe let me invite Dr. Louis as well and Doc Jazz, our partners from, and Jonna, please, from UN Women. I hope I did not miss any participating UN office. Uh, UNODC is already. That's okay. Thank you very much. A round of applause to our Department of Health. And this actually concludes our dialogue for today. But just before that, I'll ask my colleague, Jocelyn, to give us some last minute reminders for those who are traveling back to their homes and for those who are staying over for the remainder of the workshop. So a few more minutes before we let you go.
Thank you, Attorney Lee. So, hi, good afternoon, everyone. So, Jocelyn again from UNODC. I'd just like to remind for those who have accommodations and billeted in this hotel, so just some reminder. So, I know some of you will be checking in today, May 8th, right? So please do check in. And announcement, we will have our dinner from 6:30 to 8:30 p.m. And for the breakfast is 6 o'clock to 8 o'clock a.m. And again in Talk and Tech. So from here, it's just in the back of this building. And then for day two, we will start our registration 8:45 a.m. and will exactly start at 9 o'clock a.m. And for those who have flights that we arrange, so please kindly send me your boarding pass, yung papunta po, and I will also collect those sa papabalik din po. Again, thank you all for attending our dialogue. So see you all again tomorrow.
Thank you, everyone. Have a good night. Have a good, safe trip to your homes. And for those staying, you can have your dinner later. Thank you.
Wow. Okay. Okay, yeah.
way that I love your people sometimes to challenge a lot of issues. It's not living in the same way that lost negative emotions have. Not really. It's not the boss. It's there. I think that's really the only thing. Okay. Right now, everybody's and controls, you know, something about. But that doesn't mean it's good. However, the opioid overdose crisis has never changed. Okay. White people. Yeah.